Hi, this is Joan Landino Says. Welcome back. Our next topic is on something called medical food.
What is medical food?
Medical food is a folic acid. You're going to say,
What is folic acid?
no, it's a B vitamin, B9,
Okay.
which you could buy over the counter or get a prescription for it. But most people cannot metabolize folic acid fully. When folic acid goes inside our body, it has to go through 4 or 5 changes in order for it to cross the blood-brain barrier. If your body can't do that, it's just going to load up in your blood levels and you're going to have high folate serum levels. And it is not going to be helpful.
What can I expect if I take folic acid?
It will increase your motivation, your concentration, your sharpness, your alertness, your initiative, and this is going to sound weird, your sociability. Right now the FDA is actually going for this to be approved for schizophrenics, because once a schizophrenic has been properly medicated and no longer hallucinates or has delusions, they have often isolated and they are not able to socialize, and that helps them reintegrate into society.
Okay. So if it's going to cover all of those things you just said, do I use this on top of using another drug for like alertness or motivation?
Initially, in psychiatry, L-methylfolate came out in the form called Deplin. It was to augment your antidepressant. Instead of waiting 4 to 6 weeks for the antidepressant to work, you would only have to wait approximately 2 weeks. I have found that if there's a simple lab test, which there is, if you have a double mutation, I know that sounds like a science fiction movie. If you have a double mutation for the inability to properly change a folic acid to L-methylfolate, you deserve Deplin, and you may respond to Deplin so well that you may not need your antidepressant. This again is not only in psychiatry. There's another form of L-methylfolate called serapholin used in cardiology. There is another form of L-methylfolate called serapholin NAC, which slows down the progression of Alzheimer's by at least 3 years. We use all of them in psychiatry because it's just another form, and insurance companies are covering the serapholin NAC.
What does NAC stand for?
I don't know, but what it does is, we call it NAC. It actually allows your brain to keep acetylcholine in it by, just like the dementia meds, by inhibiting the acetylcholinesterase inhibitor. So it will inhibit that, which is an enzyme that will eat acetylcholine. Who doesn't have enough acetylcholine in their brain? Dementia, Alzheimer's type. And that is why the NAC portion is so great for memory and slowing down the process of Alzheimer's.
But someone at my age of 25, could I take serapholin NAC now?
Yes, of course, because we've also noticed within our practice that once we prescribe that, and again, insurance companies are driving our prescribing abilities. We prescribe it because it's covered by insurance. Once I prescribe that to someone who has ADD, I have noticed they've either decreased their amphetamine or ADD med, or they have gotten off of it completely. So did they have ADD, or did they just have the double mutation for the inability to properly change folic acid to L-methylfolate?
So do all insurance companies cover Deplin, serapholin, and serapholin NAC?
Unfortunately, no. In the beginning, yes, they were covering it. Unfortunately, the state does not cover it anymore, and certain insurance companies do not. But not to worry, we then go through an uninsured.
Not uninsured.
Yeah, we go through no insurance, and we order that through the mail for you, and you get it at a discounted price.
But if this is going to sometimes make someone not be on their ADD med because this one pill could help them with their motivation, concentration, sharpness, alertness, so on, why wouldn't insurance companies cover that?
There's a 2-decade lag from the peer-reviewed journals since at least 1985, and it'll come up on your lab slip. They give the literature cited, and I do not know why that there's been a 2-decade lag in the research and putting that into practice. All I can say is take the money out of medicine. This is inexpensive.
And you believe that this could help a handful of clients, as you call them?
Oh, it's helped many. I've had 2 clients that have attempted suicide, and they told me they did not want to do that. I did a lab test on them, this particular lab test, which, by the way, is called, it's abbreviated because the word is this long. It's called the MTHFR DNA analysis test. More Than Clinical Labs does this test, so this is easier.
And it's easier to be covered then?
Easier to be covered as well.
Okay.
The benefits for this is not, again, only in psych. In psychiatry, it shows that if you have a double mutation, not each, there's 4 genes, not every one of these genes causes this. But if you have a double mutation, multiple studies and compelling literature have shown that not being able to change folic acid into L-methylfolate interferes with your dopamine, your adrenaline, and your serotonin levels. So that would cause depression. Dopamine is our reward center. It also increases, if you can't change it over, it increases homocysteine levels, which is a protein in our blood. High homocysteine levels causes increased risk of heart attacks, all cardiovascular events, strokes, and then also not homocysteine levels, but the inability to metabolize folic acid or change it over to L-methylfolate can cause miscarriages, and while you're pregnant, it can cause preeclampsia. The layman's term is toxemia, which is also dangerous. It also causes congenital birth defects, including cleft lip and palate, and neural tube defects. So if a gynecologist gets the result of the particular mutation, they will induce labor early by C-section to avoid a neural tube defect.
Oh, wow.
And that has happened in our practice as well.
Oh, wow. Now, how would a client or myself go about getting this test done? You have to go to a provider.
You have to come to a provider. You can go to a primary care provider if they know about it. You can come to psychiatry. For some reason, we know about it a lot. And it's a simple blood test, Quest or Clinical Labs or LabCorp.
Okay. What do you mean psych knows more? Like, not all the providers know about this test yet? Is
No.
this a new one?
It's not new.
Yeah, you did say
it's not new. I don't think it's advertised. I don't think, again, I'm going to say take the money out of medicine. It's inexpensive.
Yep. So this is something that you see benefiting a lot.
A lot of people. Some people get a robust response within 2 weeks. Those 2 clients I talked about that did not want to commit suicide and felt like they were on automatic pilot within 2 weeks, they called me and said, could I possibly be feeling this much better within 2 weeks? I've also gotten a lot of cardiology clients that have gone through a plethora of tests, and $8,000 later, come to find out they have a double mutation. They also get a robust response within 2 weeks. Age has something to do with it in some clients. Sometimes it takes like 3 months before you feel the response, and sometimes it's when you just say, this doesn't work, I'm going to get off of it, and within a couple of weeks you say, oh, that actually really did help my concentration, motivation, and initiative. Okay, I know that was a confusing subject. I know I may have confused a lot of you, so please contact me at Joan Landino Says with any questions whatsoever about folic acid or L-methylfolate. This is Joan Landino Says again. Thanks for joining, and I want to thank my office manager, Michael.
Well, thank you for having me.
All right, see you next time.